Hello everybody and welcome to LyraNara.com, your leading resource for holistic health solutions. And today we're gonna talk about peptides, and not only peptides in general, but our unique My Real Way peptides that you can get exclusively in North America at LyraNara.com. And we're gonna tell you what makes them unique, and then we're gonna have a good look at some clinical studies that have been performed with our peptides and the results thereof. So without further ado, let's learn more about our unique peptides that are the real way for real health and rejuvenation for you and your family. So let's learn more about it together. And let's start off by talking about peptides in general and why they are so important for remaining holistically healthy. Well, that is because peptides are the building blocks of proteins, and the proteins are the building blocks of your whole body. So proteins are actually polymerized, so combined peptides. And when you get sick, your proteins are mutated or structurally and biochemically altered. And when these proteins are mutated, you must provide simultaneously the right energy and all chemical components and information to correct those so-called blueprints. And you need for this specific minerals, vitamins, enzymes, amino acids, energy and information. And peptides are precursors of the above mentioned components in the right proportion composition, and they're also carrying the correct information. So peptides are natural products and thus must be in the correct peptide premix, or they must be premixed in the correct amount with each other. And now your body, when you get this correct amount of the peptides that you need, your body can heal, correct, and proliferate the right building block, which are the proteins. And the body symphony can find, so to speak, the best conductor, and the melody that it creates enchants the trillions of cells in your body, and you become and remain healthy, as we will see also from the clinical studies that have been performed with our peptides. What makes our peptides, My Real Way peptides, unique on the market today? Well, the basis of our peptide is a premix of natural peptides, which is already a distinguishing factor. Each peptide chain consists of 2 to 5 amino acids, and the molecular weight of the peptides varies depending on a premix and ranges from 280 gram per mole to 588 gram per mole. Use the most modern methods of extraction, chemical conversion and cleaning of all the raw materials, and thereby we allow a preservation of the biological value of the obtained products at their full extent, so where they are the most powerful and useful for you. We use also the innovative methods of enzymatic hydrolysis of animal protein. We also use a membrane technology to extract the fractions of peptides with the desired properties and a given molecular weight that is precisely specified. We also use a unique vegetable non-gelatin capsule, and why this is important, because we can save the unique properties of the selected peptides doing this. And unlike gelatin capsules, hypromellose capsule is dissolving slower, and the nutrients are released and absorbed by the body gradually and evenly. The therapeutic properties of natural peptides of animal origin and their effect in the small intestine are preserved thereby only in a vegetable capsule. The composition of our peptides is much more complex than this, as each product also has not only the peptides but also the vitamins, minerals and herbal extracts that help it proliferate in the body in the best way possible. And all the components are thoroughly selected to enrich and enhance each other, and we use no fillers or additives. Everything is 100% natural, and therefore no side effects, and the best peptides, in our opinion, that you can find on the market today. You don't have to take my word for it that our peptides are unique in the marketplace. Just look at it yourself. Here you see on the right our real peptide preparation for your timers, and then similar product by other manufacturer called Vladonix. And you see immediately from the ingredients list that the one on the left, the Vladonix, is full of all kind of fillers and stuff that should not be in there. You know, microcrystalline cellulose, sugar beet, lactose, starch, tween 80, none of that, none of those fillers and artificial ingredients that are not necessary are in our peptide preparation. As you can see, in our peptide preparation, apart from the very high quality peptides, you get the necessary vitamins, minerals, and enzymes to help the peptides proliferate in the most efficient and most powerful way through your body, and that's what makes them unique. And of course, our peptides have been clinically tested in many studies, and in the next slides, I would like to show you some of the results from a clinical study that was performed at a very famous hospital in St. Petersburg. And they tested many of our peptides on patients in double-blind studies with control groups and everything necessary, and they published their results. You can get also the full report from us if you are interested. Here just a summary of the results taken straight from their study. First up is the BREATHTIDE Plus, and according to the forecast of the WHO, by 2020, chronic obstructive pulmonary disease will be the third leading cause of morbidity and mortality in the world. So they tested this, which is very good for these pulmonary diseases, the BREATHTIDE Plus, and the clinical characteristics of the trial was like 8 patients, 2 women and 6 men that all had chronic bronchitis in acute stage. The age of the patients was between 39 and 65 years, and the duration of the disease progression ranged from 12 to 34 years. The control group included patients with a similar diagnosis, gender, and age. The methods of the study were they wanted to evaluate the efficacy of the multi-component peptide bioregulator BREATHTIDE Plus and the dynamics of the patient's complaints, as well as objective indicators were analyzed, such as general blood, urine, and sputum tests, biochemical blood test. And here BREATHTIDE Plus contains a peptide complex, NQ, licorice, N-acetylcysteine, selenomethionine, vitamin E, vitamin A, vitamin C, and calcium hydrophosphate. And most importantly, what were the results of this trial? In all patients with chronic bronchitis in the acute stage that were treated with the BREATHTIDE Plus, a decrease in the clinical manifestations of the inflammatory process was observed in all patients. A more rapid regression of clinical symptoms in patients of the main group, that was the treated group, as compared to the control group, which didn't take the BREATHTIDE Plus, was on average by 2.3 plus minus 0.8 days. So the regression, the rapid regression of the symptoms was up to 3 days faster in the people that took the BREATHTIDE Plus compared to the control group. Their temperature normalized, the manifestations of the general disease diminished, the sputum discharge significantly was facilitated, and the coughing decreased. Especially important was also the relief of expiratory dyspnea. Normalization of the white blood cell count and leukogram were noted in the main group that took the BREATHTIDE Plus as well on days 8 to 10 of the study compared to days 12 to 14 in the control group. So much faster results with the BREATHTIDE Plus than if you don't take it. It should be also mentioned that more stable and pronounced effects were noticed with a longer duration of the multi-component peptide bioregulator, BREATHTIDE Plus. So if the group, the patients took it for 40 to 45 days, the results were even better. There were no side effects found, no complications, and no dependence on this peptide preparation was observed. And in no case was a withdrawal of this medicine required. So no withdrawal symptoms, no complications, no side effects were found in this study. And the conclusions therefore were then these results of the study performed are indicative of the clinical effectiveness of the multi-component peptide bioregulator BREATHTIDE Plus and advisability of its appointment and application in complex therapy and prevention of the bronchopulmonary apparatus disease was recommended. So very, very promising results, as you can see. Another preparation of peptides from us that was tested in this trial was URINATIDE Plus. Why? Because inflammatory diseases of the urinary system rank next to the acute diseases of the upper respiratory tract among all infections and are among the top 10 in the overall sick statistics. Our multi-component peptide bioregulator URINATIDE Plus is a well thought out mechanism of target-oriented specific impact. It is aimed at normalizing the process of urination, and it includes all the good natural ingredients that are necessary for that, and no fillers, no artificial ingredients at all, as you can see. Only the peptide complex, doorweed, sparrow tongue, herb extract, calcium hydrophosphate, vitamin B1, vitamin E, as well as vitamin PP. So what were the clinical characteristics of the patients that were participating in this trial? Well, they were all treated with the main group was treated with the multi-component peptide bioregulator URINATIDE Plus. 18 patients were tested, 12 women, 6 men. 4 female patients had already chronic cystitis, and the average age of patients was 64 to 89 years old. The duration of the disease progression ranged from 12 to 25 years, so those were long-term affected patients. In the control group, also 14 patients were enrolled with a similar diagnosis, gender, and age. Methods of the study: to assess the effectiveness of the URINATIDE Plus, the hospital analyzed the dynamics of the patient's complaints, as well as objective indicators such as general blood and urine test, including a urinary sediment, biochemical blood test, ultrasound examination of the kidneys and bladder. And what were the results? Well, from the study, in all the patients with chronic cystitis and chronic pyelonephritis, the use of the multi-component peptide bioregulator URINATIDE Plus contributed to a decrease in clinical manifestations of the inflammatory process. Body temperature also normalized, manifestations of germ disease diminished, pain and dysuria syndromes completely stopped. Especially important was also the relief of the urinary syndrome, so normalization of the uric, erythrocyte and leukocytosis were reported in the main group on days 14 to 16 of the study, and compare that to the control group where it was day 20 to 21 when the patients were reporting a relief in symptoms. More rapid regression of the clinical symptoms in patients of the main group compared to the control group was found to be on average better by 3.6 plus minus 1.1 days. So you get healthier and you can notice significant improvements that it can also be observed in clinical tests much faster, up to 5 days faster than without taking the URINATIDE Plus. There was also a decrease in the parameters characterizing the presence of chronic renal insufficiency, a decrease in the level of creatinine in the blood and urea. It should also be mentioned that the study notes that a more stable and pronounced effect of improving kidney function and absence of inflammatory process recurrences was noticed, with a longer duration of the multi-component peptide bioregulator URINATIDE Plus administration. So if you took it for even longer, 40 to 45 days, the study and the trial noted that the results were even better. In the patients who received the complex therapy with the multi-component peptide bioregulator, they did not find any side effects, complications, or drug dependence. And there was also no withdrawal and no withdrawal symptoms were observed. So the conclusions from the study were that the results of the study performed are indicative of the clinical effectiveness of the URINATIDE Plus. and advisability of its appointment and application in complex therapy and prevention of the kidney and bladder diseases is the conclusion of it. We also sent in the MEMORYTIDE Plus for testing in this clinical trial, and the clinical characteristic of the patients were all patients complained of headaches, increased blood pressure, dizziness, and fatigue. Besides this, patients of senile age were disturbed by memory loss, inability to concentrate, to keep attention, as well as sleep disturbances in all patients with consequences of acute circulatory disturbances. Focal neurological symptoms were found out as a mild or moderately expressed hemiparesis and/or ataxic syndrome of mild or moderate severity. The duration of the course of the disease was from 3 to 8 months. All patients had previously undergone a course of therapy, including intensive therapy in a specialized vascular center for the treatment of patients with cerebral strokes, and the control group included 13 patients as well with a similar diagnosis, gender, and age. Well, what did the study want to find out? They wanted to evaluate the efficacy of the MEMORYTIDE Plus application, and therefore they analyzed the dynamics of the patient's complaints, as well as objective indicators such as general blood and urine tests, biochemical blood tests, tests for assessing attention were performed, as well as tests for assessing short-term memory. And what were the results? Well, very promising. Again, it was found that the application of MEMORYTIDE Plus improved the overall well-being of the patients. In 10 of 14 patients, so more than 70% with the diagnosis consequences of the acute cerebrovascular accident, and in 3 out of 5 patients with the diagnosis transient ischemic attack in anamnesis. The regression of the main complaints was reported on average 4 to 6 days faster than in the control group. And such dynamics were characteristic from people of younger age, so in this case 58 to 70 years. The older age group had a similar but less pronounced dynamics of the subjective indicators. However, since for the elderly the absence of any changes is more common, such objective feelings were characterized as very favorable, the study also notes. The analysis of the tests for the short-term memory evaluation showed an increase in the number of words kept in mind from 4 to 5 at the beginning of the treatment to 6 to 7 at the end of the course, exceeding an average of 1.2 words compared to the control group. It should also be mentioned, the study notes, that more stable and pronounced effect of improvement of the cognitive function was noted with a longer duration of the administration of the MEMORYTIDE Plus, of 45 to 60 days in a third of all patients of the main group with focal neurologic symptoms. The severity of the hemiparesis decreased by 1 to 2 points, and also a decrease of ataxia manifestations was reported. In the control group, there were no similar changes. In all patients also, there was a significant elevation of the main symptoms of the course of this group of diseases characterized by significant torpidity. Monitoring patients who received the MEMORYTIDE Plus treatment, they did not find, again, any side effects, no complications, and no dependence, as well as no withdrawal symptoms. The conclusions, therefore, according to the study, were that the results of the study performed were indicative of the clinical effectiveness of the MEMORYTIDE Plus, and it is advisable that it is appointed and applied in the complex therapy and in the prevention of cerebrovascular diseases of the brain, therefore. Another peptide preparation that was tested is the JOINT-TIDE Plus. Again, the clinical characteristic of the patients were patients with osteoarthritis, of the knee joints that complained of pain and limited flexion and extension in the joints while walking. In the older age group, the characteristic features were joint deformations, atrophies of the femoral muscles, and weakening of the ligamentous apparatus of the joints. Patients with osteochondritis of the spine often reported the appearance of pain in the lower back also, with irradiation along the sciatic nerve. That was greatly increasing when changing position of the body, walking, and while doing exertion. The duration of the disease progression ranged from 5 to 20 years, so those were again long-term affected patients. Progressive dynamics of the pathological process development was reported, and the control group again here included 10 patients with a similar diagnosis, gender, and age. For the therapy, they used the BREATHTIDE+, which is for the prevention of the degenerative inflammatory diseases of the joints, integrated treatment of bruises, sprains, and injuries, a combined treatment of osteochondritis of the spine, and after surgery on osteoarticular system, age-related changes in the cartilages as well. The methods, again, to assess the effectiveness of the BREATHTIDE+, they analyzed the dynamics of the patient's complaints, as well as using objective indicators such as general blood tests, urine tests, biochemical blood tests, as well as X-rays of the joints. And what were the results? Again, very, very good results. As you can see, the application of the BREATHTIDE+ in patients with knee osteoarthritis decreased the local pain and increased the knee's mobility in 66.7% of the treated patients. Most of the pain almost disappeared. The radiologically determined initial stages of the disease narrowed the joint gap between the patella and the thigh, and the lateral patella osteophytes and the femoral condyle. And patients with an advanced stage of arthrosis, similar but less pronounced dynamics of the subjective indicators was observed. In patients with osteochondritis of the lumbar spine, the BREATHTIDE+ application against the background of the complex therapy that was used contributed to the reduction of the pain syndromes in 60% of the cases. And long-term use, so if they administer the BREATHTIDE+ for 45 to 60 days, improved the results even further. In all patients, again, no side effects, complications, or dependence on the BREATHTIDE+ preparation was observed, and there were no withdrawal symptoms. Therefore, the study concluded that the results performed are indicative of the clinical effectiveness of the multi-component peptide bioregulator BREATHTIDE+, and it is advisable to use and apply it in a complex therapy for prevention as well as treatment of degenerative dystrophic diseases of the joints and the spine. Next, they tested BONE-MARROW-TIDE+. The clinical characteristics here again of the patients. Typical complaints presented by patients with bone marrow affections are non-specific and consist of general weakness, increased fatigue, sweating, dizziness, noise in the ears and head, dry skin, and layering and fragility of the nails. 12 patients received periodically iron medications or some other medical therapy. However, this was uncontrolled and it is impossible to estimate its effectiveness, and the control group also consisted of 12 patients with similar diagnosis, gender, and age. They used the BONE-MARROW-TIDE+, and this is meant for therapy and prevention of osteoporosis, recovery from injuries and fractures, support of during the menopause to replenish the minerals and vitamins in elderly people as well. Methods of the study, again, to assess the effectiveness of this BONE-MARROW-TIDE+. They analyzed the dynamics of the patient's complaints, so how did they change, as well as looking at objective indicators such as general blood and urine tests, biochemical blood tests, EGDS, and a fecal occult blood test as well. What were the results? It was found that the use of the BONE-MARROW-TIDE Plus in all patients with IDA contributed to a decrease in the clinical manifestations of the disease, as well as an improvement and stabilization of the general clinical and biochemical parameters of the blood. For example, the hemoglobin level increased by an average of 24.3 grams per liter. Indicators as microcystosis, aniso, and poikilocystosis improved as well. Significantly increased was also the index of non-hemoglobin iron and ferritin. And after a long-term administration of the complex of more than 30 days in the main group, the above mentioned biochemical parameters were normalized in half of the patients. A more rapid regression of the clinical symptoms compared to the control group was found to be on average of 3.1 plus minus 1.4 days. So the patients that took the BONE-MARROW-TIDE Plus showed improvements about a week earlier than the ones that were not treated with it in the control group. A more stable and pronounced effect of the blood parameters was noticed with the longer administration again. So if you took it for 40 to 45 days instead of 30 days, the results were even better. And they did not find, again, any side effects, complications, dependencies, or withdrawal symptoms. Therefore, their conclusions were that the results were indicative of the clinical effectiveness of this multi-component peptide bioregulator called BONE-MARROW-TIDE Plus, and it's advisable that you appoint it and apply it in a complex therapy plan for prevention of IDA. Another preparation, peptide preparation that was tested is called LIVERTIDE Plus. And of course, you can get all of those peptides plus many more exclusively at lyranara.com, and I will post the links in the description box below. And the clinical characteristics of the patients here were that they all suffer from chronic liver disease that is characterized by long absence of any symptoms. So for a long time, a person can feel healthy with only increased fatigue. Pain in the right upper body quadrant where the liver is located is rare during chronic hepatitis and cirrhosis, and may be due to an associated gallbladder or the duodenal ulcer or colon lesion. Another cause of the asymptomatic course of chronic liver lesion is its significant compensatory and regenerative mechanism. So long-term absence of liver symptoms is the main reason for late detection of liver diseases. Therefore, all patients had not received any medical treatment before because the detection of chronic toxic hepatitis was essentially accidental. So the main complaints presented by the patients were for toxic polyneuropathy and consisted of general weakness, increased fatigue, weakness and paresthesia in the lower limbs, as well as difficulties walking. The control group included 3 patients with a similar diagnosis, gender and age, and they were all administered, the main group of course only, the LIVERTIDE Plus preparation, which is has a well thought out mechanism of target-oriented specific impact, and here it's meant for the maintenance and restoration of your liver's health, for the prevention of chronic hepatitis, cirrhosis, cholecystitis, biliary dyskinesia, and for the prevention of liver damages caused by toxic substances such as alcohol and drugs. It's also meant for the prevention of chronic hepatitis and to reduce the toxic effects of antiviral medicines that you take. The methods, again, to assess the effectiveness of the LIVERTIDE Plus, they analyze the dynamics of the patient's complaints, as well as using objective indicators like general blood tests, urine tests, biochemical blood tests, and results of the ultrasonic examinations they performed. What were the results? It was found that in all patients with chronic toxic hepatitis, the use of LIVERTIDE Plus contributed to a decrease in the clinical manifestations of the hepatic decompensation, decrease and stabilization of the biochemical parameters of hepatic transaminases called ALT and ACT also, Alkaline phosphatase and blood amylase was observed as well. And after long administration of the complex of more than 30 days, the above mentioned biochemical parameters were normalized in half of the patients of the main group, and a more rapid regression of the clinical symptoms in the patients of the main group compared to the control group was also observed, and that was on average by 4 plus minus 1.4 days, so 4 to 5 days that you got faster and better results. Also, a regression of the symptomatic toxic polyneuropathy in the form of an increase and/or restoration of the sensitivity in the lower extremities. An improvement of the gait and stability during walking was reported in the study, and the results of the liver ultrasound examinations showed a decrease in the dynamics of its size on average by 17.8 millimeters in the patients of the main group, and only 12.4 in patients of the control group that did not take the LIVERTIDE Plus. So a more stable and pronounced effect of the liver functions, the improvement was also noted with a longer duration of the application of the multi-component peptide bioregulator LIVERTIDE Plus. So if you took it if they administered it for 40 to 45 days instead of 30 days, the results were even better. No side effects again, no complications, no dependencies, and no withdrawal symptoms, and therefore they concluded this preparation shows a clinical effectiveness, and it's advised that it is therefore appointed and applied in a complex therapy for the prevention of liver diseases as well as the treatment, of course. And last but not least for this presentation, I wanted to share with you another test result. This time they tested a CARDIOTIDE Plus, and the clinical characteristics of the patients were that all patients complained of anginal pain, shortness of breath during exercise, restrictions of their physical activities, headaches, high blood pressure, periodic edemas on the legs and in the periorbital areas, and the duration of the disease progression ranged from 8 to 19 years. Progressive dynamics of the pathological process development was also reported. All patients used to receive basic therapy for a long time, which gave a short-term therapeutic effect, requiring a correction in the stationary conditions, and the control group included 6 patients with similar diagnosis, gender, and age. What did they use? They used the CARDIOTIDE Plus, which is a well thought out multi-component peptide bioregulator like all of the others that you can get on our page, and they are meant, the CARDIOTIDE Plus is meant specifically for the prevention of cardiovascular diseases, as well as a treatment of dystonia, neurocirculatory diseases, hypertension, stage 1 and 2, coronary heart disease and circulatory failure, metabolic disorders in the cardiac muscle, atherosclerosis, myocardial infarction, diabetes mellitus, thyroid disease, pathological climax, sleep disorders, and for the normalization of your metabolism in the myocardium during physical and psycho-emotional stress. What were the methods of the study? Again, to assess the effectiveness of the CARDIOTIDE Plus, they analyzed the dynamics of the patient's complaints, as well as using again objective indicators like general blood and urine tests, biochemical blood tests, Holter monitoring of the electrocardiogram, ECG, and PB, as well as those were performed on the system called Cardiotechnica 4000, as well as data from the echocardiography, so an ultrasound examination of the heart. The results were again astonishing. It was found that the administration of the CARDIOTIDE Plus in patients with CHD, myocardial infarction, suffered in the past in combination with hypertension, as well as chronic cardiac insufficiency and 2 to 3 functional class, contributed to a decrease in the intensity and multiplicity of anginal pain, a decrease in the clinical manifestations of chronic cardiac insufficiency, as well as a reduction and stabilization of the arterial hypertension. Another result was that a more rapid regression of the clinical symptoms was observed in the patients of the main group when you compare them to the control group, which was on average by 2.1 days. Also a decrease in expenditure of short nitrates up to complete failure in patients with manifestations of post-infarction angina was reported. However, they noticed a tendency to increase the ejection fraction by 4 to 6% after 30 to 45 days of the CARDIOTIDE+ administration. In patients of the older age group, a similar but less pronounced dynamics of subjective indices was observed, which was also qualified by the trial as a positive effect of the therapy. It should also be mentioned that better results were again achieved by a longer administration of the peptides, and they did not find again any side effects, complications, dependencies, as well as no withdrawal symptoms, and therefore they concluded again that according to the results of the study performed, they were indicative of the clinical effectiveness of the multi-component peptide bioregulator CARDIOTIDE+, and it was therefore advisable to use it and apply it in a complex therapy as well as for prevention of such diseases. So there you have it. My real whey peptides exclusively at lyranara.com. There is no other peptide preparation on the market today that we know of that is of such high quality and that has proven effects in clinical studies like we have shown you. Please contact us at lyranara.com. You can also reach us toll free, of course. And I'm gonna post all the important information to our peptides as well as all the contact data, of course, in the description box below. It's the best way of naturally healing diseases that you have seen, as well as maintaining and preventing disease, maintaining your health and preventing serious diseases. So for the real good life, healthy, holistically healthy life, as you have seen, without any side effects, without any dependencies, there is no other way and no better way, if you ask us, to care for your health than with my real whey peptides. So until next time, stay healthy, and if you have any questions, comments, etc., don't be afraid to call us and discuss your needs with us. We are more than happy to help you along and help you remain and stay healthy.